Now, one federal MP in particular has been pushing hydroxychloroquine. It's Liberal Craig Kelly, saying, please, please, please look at the evidence. He gave a great speech about this yesterday in Parliament. But for that, he was today branded dangerous by Labor MP Mike Freelander.
The member for Hughes is the most dangerous man in this parliament.
The most dangerous man in Parliament? Well, actually, Dr Freelander, Kelly isn't killing anyone at all by asking governments to simply examine this drug. But governments, including people like you, may be killing hundreds of Australians by refusing to even look. That's what I call dangerous. But even more disgusting was Labor's health spokesman, Chris Bowen, actually trying to get Parliament to crack down on Kelly, to shame him into silence.
In his speech, the member said that media bias, groupthink and complete abandonment of reason were driving a war on hydroxychloroquine. In Australia, potential therapies are assessed for safety and efficacy by the Independent Therapeutic Goods Administration, and the TGA strongly discourages the use of hydroxychloroquine to treat COVID-19 or prevent COVID-19. It is the responsibility of all public office holders to acknowledge and support the independence and expertise of the TGA and counter misinformation and conspiracy theories.
I could ask Mr Bowen, what kind of man, claiming to be our next health minister, should Labor win, actually wants to stop debate on a treatment that other experts say could save lives? Actually want to stop a debate on something like that? Seriously? Well, damn that. Joining me is Liberal MP Craig Kelly, because I believe in debate. Craig Kelly, thank you for joining me. Labor says you are peddling misinformation and conspiracy theories about hydroxychloroquine. The Therapeutic Goods Administration says you're wrong. They've got some expert panel here that looks at drugs, looked at 9 studies, that only the studies that said that it didn't work, looked at them, said you're wrong too. Your response?
Well, Andrew, firstly, all I am arguing is that we need a second opinion on our state health medical officers prohibiting Australians and their doctors from sitting down together and discussing it, and from their doctors to prescribe them hydroxychloroquine. If a doctor thinks that is going to save an Australian patient's life, why are we banning it? Because we've actually stepped in, we've had all these state health officers come in and put bans in place. And in fact, in Queensland, a doctor can even go to jail for 6 months if they prescribe hydroxychloroquine to a Queenslander. Now, I'm saying we need to have a second look at this. Is this ban that's been put in place especially, is this justified? And on the evidence, Andrew, if you look at it, if you look at all the observational studies, study after study after study is now showing that, there must be something in this hydroxychloroquine. I'm not a doctor, I don't know the medical reasons for it. But when you get 40 plus studies that all show hydroxychloroquine is effective, surely we must look at lifting this ban here in Australia.
Craig, look, for me, it's a command, that you may not dictate it from the top.
That's right.
Rather than let the doctor and their patient decide for themselves. That disturbs me. Give advice by all means, but not ban it.
Right.
Now, you mentioned studies. The government panel that looks at whether or not it worked, it studied only 9 studies that said it didn't work. It ignored the ones that said it did work, ignored the ones that actually, the studies with zinc, which I think is important in this. I've talked about it before. Now, I find it ironic, though, despite all that, I find it ironic that in this very week that Labor is trying to shut you down, we have had 3 more studies saying it does work, even without zinc, which should make it work even better. Let me list them. There is an American study, Hackensack University Medical Centre, says hydroxychloroquine taken early means people less likely to need to go to hospital. In its words, was associated with decreased risk of subsequent hospitalisation. There's the Italian study in the European Journal of Internal Medicine. Use of hydroxychloroquine in hospitalised patients is associated with reduced mortality. they were actually 1/3 less likely to die. And there's the big Belgian study I mentioned the other night that said the same. Patients with hydroxychloroquine were 1/3 less likely to die. Deaths of hospitalised patients with hydroxychloroquine, 18% dead. Without hydroxychloroquine, 27% dead. Now, that's just in the week that the Labor's trying to damn you. What does it say to you?
Well, Andrew, you can actually add 2 more studies onto that. We were late last week. So in the last 7 days, there's actually been 5 studies. There was another study in Spain of 9,644 patients, and it found those that were taking hydroxychloroquine actually had a 50% less chance of dying. And then you had another study, Andrew, this one out of Marseille in France, that looked at 226 infected residents in nursing homes. And it also, Andrew, found a 41% lower mortality for those that took hydroxychloroquine. So those 5 studies over the last week, the last 7 days, the chances of those all being wrong, even if you're just flipping a coin, is something like down to 3% that they could all possibly be wrong. Now, with this evidence, surely these state health officers have to look at it and have to hand the freedom back to the doctors and the patients. Allow Australians to have access to this drug. If they think it should, if their doctor thinks the treatment is worthwhile, surely we can't have these state health bureaucrats blocking access to it, especially when all these studies show that it can save lives.
I think it all went wrong when Donald Trump recommended hydroxychloroquine, and every leftist and so many of the doctors involved in, sort of like boards and AMA and all that are of the left. They seem suddenly to go deaf and blind to any evidence that said it works. It's just ridiculous. Craig Kelly, thanks for trying to at least get a debate.
Thank you, Andrew.
Now, again, I'm not saying this drug works. I'm saying there are experts and studies that say it does, and I haven't heard a convincing reason for banning it. And I've got to wonder, is this big pharma, these big pharmaceuticals, we're talking hydroxychloroquine, is a drug that is just a generic drug. They make sense, a few cents from the sale of a drug like that. But if they get a new cure patented, they make billions from that. I reckon that's got something to do with it. Plus all the doctors that don't want to do studies saying, oh, no, don't worry, don't do that, go for the generic drug. They don't want to be cut out of that loop. Look, sorry, I don't want to sound like a conspiracist, but my God, I can't understand what's going on.